So one thing that's it came out from a study that we did a few years ago is the fact that it's not just the quantity of touch that matters, but the quality. So usually people say, oh, the more the merrier. In the case of touch, not, because touch can also be overwhelming. So in this study, we tested the relationship between mother and infant when the infant was 12 months. And actually, we saw that the way in which the mother was able to understand the needs of the infant, it actually translate on a more appropriate use of touch with the infant, while mothers that were not really able to understand what the infant needed in the moment were also mothers that tend to use too much touch, maybe, and also in a more aggressive and assertive way. So it was very overwhelming for the infant, who in turn also reacted in a less appropriate way, tactile speaking.
So it's almost, if we want to go back to your suggestion of talking about the communicative function of touch, there was, in some cases, a dialogue that was very smooth. They understood each other, and there was a back and forth. And this really is the reciprocity, I think, that you were talking about before. And then in these other cases where it's kind of like people trying to be helpful in the kitchen and getting in the way, doing too much when actually less might have been more efficient.
Yeah, but another thing that maybe would be interesting to point out in this pandemic situation which we found each other. So for what I was speaking with a lot of the medical doctors in Italy, who are my friends, or also nurses, they know how to study touch, and they tell me how touch has been actually fundamental in the COVID world right now, because when the patients are not able to actually see the person properly because they have all the protective materials, and they cannot really talk to them because they have the face mask and anything, they always rely on touch to let the patients know that they're there. So, just by squeezing their hand, to let them know everything's going to be fine, we're here for you. So again, despite the fact that we cannot actually touch each other, also through the protective equipment, they say that touch is the most reliable sense right now.